Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Myself, Dr. Sujit Ghosh, from channel Dr. Ghosh Presents. You know, I am doing for last more than 1 year videos on homeopathy. There are 4 different playlists. Homeopathic therapeutics in Bangla, homeopathic therapeutics in English, homeopathic remedy picture in Bangla, homeopathic remedy picture in English. Now actually what I want to say is that you will get about 12 to 1300 videos on this subject. Top 8 homeopathic remedies for tumor. Tumor may be spelled in 2 different ways, that is shown. What is a tumor? A tumor is an accumulation of abnormal cells in the body, an unwanted solid mass of tissue which may be fatal or benign. What are different types of tumor? Tumor are of many different types, but in simple classification they are of 3 types. Benign, these pose no danger to life. They occur space but do not infiltrate, do not metastasize, remain contained, nor do they cause death or any serious injury to the system. Like examples: fibroma, lipoma, angioma, etc. Malignant or cancerous. This tumor infiltrate into structure. Infiltrate enters into the structures nearby or metastasize. Metastasize from moving from one place to another into distant places to create tumors. They are mostly fatal, like osteosarcoma, squamous cell carcinoma, breast cancer, etc. Precancerous. These tumors are benign to start with, but later on may transform into malignant tumors such as cervical dysplasia, colon polyp, etc. Now on the right hand side, note the pictures. This is benign tumor. Benign tumor is closed. This is closed. Malignant tumor are open. They have no regular border. This is a regular border and contained. It is not contained. It is diffused. It is moving from one place to another place. Shape also. Note this shape. Uniform shape. This is irregular shape. There are blood vessels, malignant. Why are tumors formed? Cells of a tissue of our body constantly replicate to replace dead and worn out cells. Whatever may be the tissue, say in liver, in heart, in brain, in skin, anywhere, the cells are constantly dying. So that must be replaced. So there is cell division and cells are formed. But when, due to some reasons, the rate of replication surpasses that of dying cells, extra cells form tumor. How can a benign tumor be differentiated from a malignant tumor? Note this point. I have make column benign, malignant. Fast growth, slow, fast. Benign, slow, malignant, fast. Periphery, regular, irregular. There is periphery means this outer shape, outer border. Shape, smooth, uneven. Attachment, no. Benign tumor, no attachment. Malignant tumor, yes, attached. Mobility, benign tumor, mobile. You can move the tumor. If you say some tumor on the skin and you touch the tumor, you catch the tumor and try to move it, you will see that it is moving. But in case of malignant, it is fixed. What are risk factors of tumors? Inherited condition like mutated gene, disease like neurofibromatosis, breast cancer, etc. Smoking, exposure to toxin, to radiation, viruses like HPV, human papilloma virus, obesity. Risk factors is these persons are having the factors which enhance the disease, that is risk factor. What are the symptoms of tumor? Symptoms depends on the place and nature of tumor. However, the following symptoms may be there: fever, chill, fatigue, loss of appetite, loss of weight, night sweat, pain, unusual discharge. How are tumors diagnosed? Mainly by biopsy. Cutting a portion of tumor tissue, sometimes the whole tumor, again sometimes the fine needle aspiration biopsy or cytology are done to note the cell characteristics of tumor. Look at the picture on the right hand side. Say this is a tumor. What is done? Some portion of the tumor is cut out and that portion is examined under microscope to know the cell characteristic, whether it is malignant or normal. This is the basic thing of biopsy. Now we have come to remedies. Arnica for tumors. Benign tumors following a contusion or similar injury, dull, tingling pain in indurated part, pus thin, watery, red, blue, yellow spots of ecchymosis. Calibrum for tumors, especially ovarian tumors, profound melancholic delusion and religious depression, fidgety feeling, move about, night terrors. Phosphorus for tumors, profusely bleeding open cancers, polypi bleeding on slightest provocation, lipoma, encephaloma, large, rough, dry condylomata, filling vagina, lymphoma on neck with hectic fever. Phosphorus is a very good medicine for tumor and mostly malignant tumors. Bradycarp for tumors, glandular and atheromatous tumor, especially in old person. Pus scanty, growths though, lipoma especially of drunkards, sarcoma in neck with burning, worse at night, better when walking in open air. That is, bradycarp can take up both type of tumors, benign or malignant. Platina for tumors. Ovarian tumors and cyst with induration and ulceration of uterus. Patients think themselves superior, bigger than others in all respects. This is the mental characteristic of platina. Platina patients are very much proud and having what is called superiority complex. Muriatic acid for tumors. Cancer of tongue when the edges of ulcer and surrounding parts are blue color. Cornea maculatum for tumors. Tumors of all kind, especially serous cancer. Serous means like some type of cancer coming on after contusions. Stony hardness of tumor, cancerous swelling of lips, face, and induration of glands. Secondary deposit. Induration means hardness. Whenever some tumor, whenever hard, this is this means that this may be malignant tumor. Generally, benign tumors are soft, smooth, mobile, but irregular, hard. This is a characteristic of malignant tumors. The tumors cause death. Fibroids worse from pressure, rubbing in open air or being covered. That is fibroids worse all this from all this characteristic. That all this situation from pressure it is worse, from rubbing it is worse, in open air it is worse, being uncovered it is worse. Fibroid tumor, generally ordinary tumor. Condurango tumors, squamous and open carcinoma. That is condurango mainly for malignant tumors. One of the best remedies for alleviation of stinging, burning pain of cancer. This is very important, very important. You will get patients, the patient will just cry, sir, you please give me some medicine. I cannot tolerate this pain, this stinging, burning pain. This stinging, burning pain for alleviation, not for cure. Mind it, condurango has not that power to cure, but it can relieve the pain. That is very much necessary while you are in chamber, because your duty also not also cure. Your duty, primary duty is to cure, but if you do not cure, if you can relieve the patient, that is also something very much important thing. However, with this the video ends. Anything you want to say, please write it in the comment section. I will certainly attend.